We are now to the third chapter in this unit, the female reproductive system. After this, we just have the neonatal and obstetric chapter, and then we will be ready for the chapter 6 to 9 test. First, we're going to cover all of the organs and structures in the female reproductive system, and then we're going to actually move on to assigning the medical terms that go with those structures. Guys, you had an advantage in the last chapter, obviously knowing your own organs. In this chapter, females have the advantage. The function of the female reproductive system is pretty straightforward. Its job is to support both conception and pregnancy, so, creating a baby and then supporting that until it's born. There are also hormones produced by the ovaries, such as estrogen and progesterone, that support those conception and pregnancy as well. Just like the male reproductive system, the female reproductive system has external and internal components. So this slide's just showing you what is external. There is the vulva, which is a structure that's job is to surround the vagina area, which we'll get to on the next slide. The clitoris, and then not shown here, we have the mammary glands, which I'm sure you all know what they are. Internally, the female reproductive system has the vagina, which is about a 3-inch long structure that connects the uterus to the outside of the body. The uterus itself is a pear-shaped muscular structure that normally hangs out in the pelvic cavity. Unless a woman is pregnant, then it kind of blows up into the abdominal cavity. And it functions in menstruation, pregnancy, and labor. There's the uterine tubes. You have 2 of them if you're a female, and those are responsible for carrying the eggs from the ovary to the uterus area. The uterine tubes are also called fallopian tubes. And then finally the ovaries, there is 2, one on either side of the uterus, and that's where the eggs are made and stored. As I mentioned on the previous slide, the ovaries are almond or circular shaped organs on either side of the uterus in the pelvic cavity, and that's the structure where the egg cells are stored. It's interesting to note that a female is kind of born with all of the eggs that she will ever have. They're not all mature eggs when an female is born, but there are over 100,000 microscopic little sacs that could have the potential to turn into eggs. And an ovum is, or ova for plural, are what those female sex cells are. That's the medical term for an egg. The uterine tubes just act as a passageway to move the ovum from the ovary to the uterus. And they're called fallopian tubes also based on the person who first described them. So this is an example of an eponym. The uterus itself is a pear-shaped muscular organ, and the muscular portion kind of comes into play in terms of pregnancy and labor. And it functions in menstruation, pregnancy, and labor. There are 3 linings to the uterus: the endometrium, endo meaning inner, myometrium, myo meaning muscle, so that's the muscular middle layer, and perimetrium, which is the outer or surrounding layer of the uterus. There's also sections of the uterus, and each section has a name similar to, the intestines and the digestive tract, each having a name. There's the corpus, or the body, which is the main portion of the uterus. The fundus is the very top rounded portion. And really, you don't have to know what those 2 sections really are. There aren't really any medical terms that talk about them specifically. But there are medical terms with the last section, the cervix. The cervix is the narrow bottom portion of the uterus that connects kind of the uterus to the vagina area. And this part really comes into play when you're talking about labor and giving birth. Below the uterus, underneath the cervix area, is the vagina. It's about a 3-inch tube whose job is to connect the uterus to the outside of the body. There is a small membranous fold near the opening of the vagina called the hymen. That's something that every individual female has. And then, the first time they have intercourse, that's typically what is broken, is the hymen. There are also Bartholian glands. There's one on either side of the vagina, and that's the mucus-producing glands. So their job is to kind of keep that area lubricated. Here's a picture of what the mammary glands or breasts look like in cartoon form, kind of under the skin. Their job is to produce milk for the newborn infant after pregnancy. And you'll see that each breast consists of 15 to 20 different divisions or lobes, and each one of those lobes, is a sac that fills with milk during lactation. All right, now that you got the anatomical structures down to the female reproductive system, now we're going to actually go into what the combining forms are. The first word on the list is archaeo. Archaeo is a generic term that can be used in a number of chapters. It means first or beginning. And typically here in the female reproductive system, it's going to be referencing the first menstrual cycle or the first pregnancy. Cervico, cervix. Colpo and vagino both mean vagina. So vagina is kind of the easiest one to remember, but oftentimes you're going to see colpo used in the real medical practice. Coldo means cul-de-sac, and you can think of like a street cul-de-sac as one that doesn't really have an outlet. It's the same here. In medical terms, a cul-de-sac is a anatomical structure that's closed at one end. In this case, for the female reproductive system, you're talking about the uterine or fallopian tubes, because it kind of dead ends at the ovary, if you will. There's a closed end in that way. Apesio and vulvo both mean vulva. Again, vulva is the easy one to remember. However, apesio is used a lot. Gyno and gyneco, both of those terms mean female. So for example, you would go to the gynecologist or study gynecology. Those are examples. Hymeno is the hymen specifically. Hystero, metro, and metri all mean uterus. Hystero is kind of the easier one. That one's used most often, but we will see metro and metri used when we're talking about menstruation, for example. Mano and masto both mean breast. So, for example, if you are going to get a mammogram or a, mastoplasty, for example. Meno means menstruation. Oophouro, with two O's, pay attention to that. Oophouro means ovary. Perineo is for perineum, and we didn't specifically talk about that one previously, but the perineum is actually both in men and women, but for women it's the area between the vaginal opening and the anus. So it's kind of that little section of skin, and there will be one or two medical terms that go along with it. And the last one here we have salpingo. Salpingo is referencing the uterine tube or fallopian tube. We have coldo as well, but salpingo is specifically referencing the uterine tube area. If you have a diagram, now would be the time to take a moment and see if you can label it as a study aid for yourself. There's one prefix in this chapter, peri. Peri means surrounding. So for example, the condition perimetritis is inflammation surrounding the uterus, because metri means uterus. Suffixes, there's two. Atresia. In this case, atresia means absence of a normal opening. So it's either occluded or it's fully closed. There's not a hole, for example. So hysterectomy would be an abnormal closure in the uterus. Salpinx is referencing the uterine tube or fallopian tube. So pyosalpinx would mean that you have pus in your uterine tube. And note from the previous slide, we have salpingo. Salpingo also means uterine tube. So it just kind of depends on the medical word you want to create, whether you use the word root combining form salpingo or the suffix salpinx. The combining form that means vagina is A. colpo, B. coldo, C. metro, or D. masto. Hopefully, you're choosing A. colpo, even though it doesn't look like what the actual structure is. Coldo is for cul-de-sac, metro is for uterus, and masto is for mammary glands or breasts. Here's the first part of the list for diseases and disorders built from word parts. First, we have amenorrhea, and we'll see menorrhea a few times. Meno meaning menstruation, and rhea, if we remember, means discharge or flow. So amenorrhea would be the absence of menstrual flow. Guys who don't know, girls get their period every month or so once puberty begins, and there is a monthly menstrual flow associated with that, so this would be the absence of that flow. The next is Bartholian adenitis. So in this, it's referencing the Bartholian glands that are on either side of the vagina, whose job is to lubricate. Adenitis would be inflammation of a gland, so this would be inflammation of those specific glands. Next is cervicitis, so inflammation of the cervix. Colpitis would be inflammation of the vagina. You could also say vaginitis. Both of those are used fairly interchangeably in real medical practice. There's dysmenorrhea. So again, we're talking about menstrual flow, and instead of having an absence, we have painful. Dys as a prefix means painful. Endocervicitis. This would be an example of inflammation of the inner lining of the cervix, whereas cervicitis is just kind of a generic blanket term for all of the cervix. Endometriosis is inflammation of the inner lining of the uterus, the endometrium. Next, hematosalpinx. Hemato means blood, so in this case you have blood in your uterine tube. You can also have hydrosalpinx, where there is water in the uterine tube. Next, hysterectomy. That's a word I mentioned before. In this case, you have closure of the uterus or the uterine cavity. So there's some kind of closure or blockage. Mastitis is inflammation of the mammary gland or the breast. Menometrorrhagia. Rhagia is different as a suffix than rhea. Rhea is just a flow or discharge, whereas rhagia means you have a rapid flow. So it's kind of above and beyond. And menometrorrhagia would be a rapid flow from the uterus during menstruation. So it just means that there's an extra amount of discharge than there normally would be during specifically menstruation. It could also be between menstrual cycles, but usually it's referencing specifically menstruation. Again here, for the first word, we have menorrhagia, which in this case is excess menstrual discharge. This is solely during menstruation, so you have a rapid flow of blood at this time. Whereas on the previous slide, we have menometrorrhagia, which is during menstruation, but could also be not during menstruation. Metrorrhagia is a rapid flow of blood from the uterus, and that is specifically not during menstruation. So when it doesn't have the word meno in there, then it's occurring not during menstruation. Then there's myometriitis, which is inflammation of the middle lining, the myometrium of the uterus. Oligomenorrhea. Menorrhea, again, is discharge during menstruation, so the normal levels of discharge. Oligo means scanty or few, so there's less discharge than normal. Oophoreitis would be inflammation of an ovary. Parametritis would be inflammation of the outer lining of the uterus. Pyosalpinx. Pyo means pus, so there is pus in the uterine tube. Salpingitis is inflammation of the uterine tube. Salpingocele. Cele as a suffix means a hernia or a protrusion. So salpingocele would be a protrusion of the uterine tube. So there might be some kind of hernia that occurred in the uterine tube area. Vaginitis is inflammation of the vagina, and vulvovaginitis would be inflammation of both the vagina and the vulva. That was a lot of terms. So go ahead and see if you can try exercise 9 on page 303 and 304 in your book to get all of these straight. A lot of them are very similar. They just have an extra word root added on or a slightly different suffix. Here's just a cartoon example of what salpingitis might look like. Generally, it means an inflamed uterine tube. It could be a singular tube, or it could be a bilateral issue where both of them are inflamed. It can be very painful, and we'll talk about what could cause this a little bit later on. Which term means a rapid flow of blood from the uterus at menstruation and between? So you should ask yourself, we have menstruation and between. Is it menorrhagia, metrorrhagia, menorrhea, or menometrorrhagia? Well, you have a rapid flow, so you should be able to immediately eliminate C because rhagia means rapid flow. It's during menstruation, so you need meno in there, which eliminates B, and between, so you need both meno and metro. The correct answer is D. We're now to the diseases and disorders that are not built from word parts, and many of them on the list here are cancers. So a cancer occurring in the different areas of the female reproductive system. There's breast cancer, there is cervical cancer, there is endometrial cancer, which is also called uterine cancer. There is ovarian cancer. So it's just a malignant tumor or growths in the various anatomical regions. Other terms here, starting off, we have adenomyosis, which kind of looks like it's from word parts based on, the components. But it's a growth of the endometrium into the muscular portion of the uterus. So what's happening is there's some kind of growth from the inner lining of the uterus into that middle muscular lining of the uterus. You can also have endometriosis. Endometriosis is a condition where there is endometrial tissue that grows outside of the uterus. So the inner lining tissue to the endometrium is going to be growing in areas that are not endometrial tissue. So this occurs outside of the uterus. It could be in the pelvic cavity, it could be in the ovaries, it could be in the uterus. There's a picture of it on the next slide I'll show you. Fibrocystic breast condition, or FCC. This is where a lot of benign, meaning non-cancerous, non-malignant, cysts grow in one or both breasts, and those growths can become very painful. It's also called fibrocystic breast disease. You could have a fibroid tumor. This one is usually benign also, so non-cancerous, in the uterine muscle. It could be called a myoma of the uterus if it is in the muscular myometrium as well. Next up is pelvic inflammatory disease, or PID, and that's one of the main causes of one of the diseases that we saw on the previous slide. And in this case, what it is inflammation of some or all of the female organs. And it's oftentimes caused by pathogens, but it could be other things as well. And it usually starts lower in the reproductive system, and it can, if left untreated, move upward from the vagina and actually infect the uterus or the ovaries. And the increased in severity of the inflammation, then it could eventually lead to infertility and other worse conditions. A prolapsed uterus is also called hysterectomies. That would be the from medical word parts, referencing the downward displacement or drooping of the uterus. And what that means is the uterus is not in its normal anatomical position, but it's somehow gotten pushed downward into the vagina area. Toxic shock syndrome, or TSS. This is caused by a bacteria, either Staphylococcus aureus or Streptococcus pyogenes, and that infection is causing illnesses such as fever, rash, vomiting, diarrhea, and in very severe cases it can cause death. And guys, don't be super grossed out, but usually this particular syndrome is caused by women using tampons. So not following proper hygiene in the tampon area can lead to toxic shock syndrome. And the last one here, we have a vesicovaginal fistula. And we might have talked about this in a previous chapter, but a fistula is an opening between two areas where there's not supposed to be an opening. In this case, there's an opening between the bladder and the vagina. And you might ask yourself, how could this be? And there's an actual picture of it in your book on page 307 in Figure E that gives you a cartoon picture of what that looks like. But there's an artificial opening there, and you can imagine how that might lead to issues with the bladder holding urine and so on. This is the cartoon picture of what endometriosis looks like. Again, breaking down the word, it is the abnormal condition within the uterus. So the endometrial tissue is now growing in areas outside of the uterus. And from this side view, the uterus is that kind of folded over structure above the bladder. It doesn't look as clear because this is the side view and not the typical health anatomical view that you see from the front. But all of those little black areas are parts where the endometrial tissue is growing where it shouldn't be growing, and eventually it can cause health issues. Starting with the surgical terms built from word parts, a lot of these terms have to do with either incisions or removal. So most of these terms are going to end with ectomy, for example. The first of which is a cervicectomy, and this is for excision of the cervix. And you ask yourself, why would you possibly want to do this? Perhaps there is a cervical cancer issue, so then you would go in and remove the cervix. Next we have colpoperineal raphe. Raphe as a suffix means suturing. In this case, they're going to be suturing both the vagina and the perineum, which is that section of skin between the vagina and the anal opening. Again, why would you possibly need to do these things? Any female who has, given birth, the process of labor and birthing can potentially tear and or rip all kinds of this stuff down there that might require suturing. So this is one of those examples of something that could tear or rip that could need suturing. All right. Next we have a colpoplasty. Plasty means surgical repair. So a colpoplasty would be surgical repair of the vagina. Colporaphy would be suturing of the vagina. Coldocentesis. The suffix centesis, if we remember, means surgical puncture, to aspirate fluid. So there's some kind of fluid buildup in a fallopian tube or the rectouterine pouch area, and whether it's pus or water or whatever, they have to go in and aspirate that fluid. Next we have episioperioneoplasty, so surgical repair of the vulva and the perineum. Episiorrhaphy, this would be suturing of the vulva. Then we have hymenectomy and hymenotomy, so removal of the hymen or incision into the hymen. Sometimes when females begin or start puberty, if the hymen has not been broken previously, that's something that they do at the gynecological office. Hysterectomy is removal of the uterus, and we'll talk a little bit more about what the different types of hysterectomies are. You can also have a hysteropexy, which is surgical fixation of the uterus. So if you have the condition of prolapsed uterus, where it's drooping below where it's supposed to, then you would do a hysteropexy to lift it up and put it back where it is supposed to be. And the last one is a mouthful, hysterosalpingo-oophorectomy. So you're removing not only the uterus, but also the fallopian tubes and the ovaries. And we'll talk a little bit about why you might need to do something like that. Continuing on, we have a mammoplasty, so surgical repair of a breast. This is the fancy word for saying a boob job, whether it be to enlarge or reduce, or potentially even reconstruct after removal of a tumor for breast cancer, for example. A mastectomy would be a removal of a breast, and there are different types of mastectomies that you can also get depending on how severe the removal needs to be. Oophorectomy is removal of an ovary. It could be one, it could be both. Peritoneorrhaphy is suturing of the perineum. Salpingectomy is removal of the uterine tube, whether it be one or both. Salpingo-oophorectomy is removal of the uterine tube and ovary. Salpingostomy. Ostomy is the creation of an artificial opening. So this is the procedure that's done to try to reverse sterility in a female. If a female gets her tubes tied, so to speak, they can cut and suture the uterine tubes similar to a male's vasectomy. And in this procedure, they would basically try to reconnect the ends of the uterine tube back together to try to reinitialize fertility. And then a vulvectomy would be removal of the vulva. That's a lot of words. Go ahead and work on exercise 17 to try to keep all of them straight. And your book kind of goes through different types of hysterectomies and different types of breast tumors as well, as has a few pictures in your book that might be helpful to you. So here's kind of just a graphic to show you what the different types of removals are for a female, and it could be for various reasons, but it gives you an idea of what you can remove. So in the top left, for example, you're removing everything: the uterus, the fallopian tubes, and the ovaries. So that would be called a hysterosalpingo-oophorectomy. And note, we do know that there are a few other word roots for uterus that could potentially be used interchangeably, although hystero is the one used in common medical practice. When you look to the top right, you just have removal of one uterine tube and ovary. So that would be a salpingo-oophorectomy. And that would be considered unilateral. You could do a bilateral and have both of them removed, which is what you see on the bottom left. That is also a salpingo-oophorectomy, just a bilateral one. And the bottom right, the uterine tubes and ovaries are left intact, only the uterus is removed, so that's a hysterectomy. Here's kind of just an explanation of the pictures I already described. You're not going to be responsible for knowing what the different types of hysterectomies are. It's more of a FYI for you. It's the same thing here with types of breast tumors. I'm not going to be expecting you to know all the different types. Just know what a mastectomy is, but this is a for your information type of thing, to know that a mastectomy doesn't just necessarily mean taking off an entire breast or two. Here we have the surgical terms that are not built from word parts, and there are a number of them that have abbreviations that go with it. The first of which is anterior and posterior colpography, also called A&P repair. Colpography would be suturing of the vagina. So in this case, you are surgically repairing a weakened wall of the vagina. And your book kind of talks about how that could occur. It could be a cystocele, for example, where the bladder is pushing really hard against the vagina and causes the vaginal wall to weaken. But this is just where you kind of go in and add sutures to strengthen the wall. Conization is a surgical procedure to remove a part of the cervix, and they do this in order to treat cervical cancer. You can also call this a cone biopsy. Dilation and curettage is the next word, also abbreviated D&C. And basically what this is to open up the cervix area and scrape out the endometrium of the uterus with something called a curette, which is why it's called curettage. And the little curette kind of scrapes out the endometrium, and this could be to get a sample for disease analysis. If there is a bleeding issue in the uterus, then this might assist, and also to help after a miscarriage to clean everything out. Endometrial ablation is the next one. To ablate something is to basically carry it away. They use a laser or some form of electrical energy to zap and kill certain cells. In this case, they are doing it to remove endometrial cells. And it could be from endometriosis, or it could also be for abnormal menstrual uterine bleeding to try and correct that. The next, laparoscopy or laparoscopic surgery. It's kind of lumped in here just because a lot of female surgeries are done this way, but it just means that you are doing a surgical procedure through the abdominal cavity. So usually you take a few tiny incisions in the stomach area or the abdomen and insert all of your, laparoscopic surgery tools to minimize, large incisions. So a lot of surgeries in various structures and systems are done this way. Next is a myomectomy, and this is where they remove a myoma or a fibroid tumor from the uterus area. Sentinel lymph node biopsy. If we haven't talked about this previously, a biopsy is a test that is done to see if a group of cells or an area is cancerous. So in this case, they inject a dye into the lymphatic system that has a radioactive isotope, and it helps to identify certain lymph nodes that could potentially be cancerous. And they take a sample of those lymph nodes and test them. There's also something called a stereotactic breast biopsy, and in this case they use mammograms and computer assistance to try and get a piece of a breast tissue and determine whether or not it's breast cancer. Tubal ligation is the fancy way of saying you're getting your tubes tied, and that's where they sever the uterine tubes and tie them off to prevent further instances of pregnancy. And lastly, uterine artery embolization. And really this is just a procedure to try and block the blood supply to fibroids or fibrous tumors. So they kind of cut off blood flow to those tumors in the hopes that they will shrink and not cause any more problems. So this cartoon kind of puts together both laparoscopic surgery and tubal ligation in one. You can see how there was a small incision made into the abdomen to insert the laparoscope and the forceps, and that was what the needle going towards the uterine tube looks like. There's also a instrument inserted through the vaginal opening as well to complete the procedure. On the zoomed in picture you can see that the uterine tube has been ligated and kind of sutured off. Which of the following means excision of a fibroid tumor? Mastectomy, myomectomy, or oophorectomy? Well, they all mean excision. The correct answer is B, myomectomy. A is a removal of a breast, whereas C is a removal of an ovary. Now we're to the diagnostic terms. There are diagnostic imaging terms here as well as endoscopy terms. On the left we have a hysterosalpingogram. Gram as a suffix means the radiographic image, so the picture. In this case we have a picture of the uterus and uterine tubes. A mammogram and mammography. Mammography would be the actual radiographic imaging of the breast, so the procedure. And a mammogram would be the picture that you get, or the radiographic x-ray picture of the breast. And there's a picture of it on the next slide. Sonohysterography, here they are doing an ultrasound, basically, of the uterus, and then making a recording of that, and then you can gather information about the health of the uterus by looking at that afterward. On the endoscopy side, there is a colposcope and colposcopy. So that would be the instrument used to examine the vagina and the cervix, as well as the actual procedure or process of looking at the vagina and cervix. A coldoscope and coldoscopy is the instrument and the procedure of looking at the Douglas cul-de-sac, or the rectouterine pouch, as it's called in your book. Then there's hysteroscope and hysteroscopy. So the instrument used and the process of looking at the uterus. So notice how for endoscope there's a lot of them that are like paired together. Just know that scope is the instrument and scopy is the actual procedure of, looking at whatever they need to look at. Here's a picture of what a mammography looks like. On the left is the mammography itself, the actual picture, and you can see it does not look very comfortable for the girl. They basically smush the breast in between two plates so that they can take good x-ray images. And then on the right is what the mammogram looks like, the actual picture. And in this case you can see there are extra white areas, and that's where there is glandular and fibrous tissues that could potentially be cancerous. And then the darker areas, that's where there is fatty tissue. Continuing on here, we have transvaginal sonography. Sonography is another way to say an ultrasound. So in this case, they're going to do it transvaginally, meaning that they insert a transducer into the vagina, and then they can gather images on the ovaries and the uterus and the cervix and all of the surrounding structures to try to get a good idea about maybe masses or tumors. They can even use it to monitor pregnancy or ovulation. In terms of lab tests, one key test for ovarian cancer is a CA-125, or cancer antigen 125 test. That is a tumor marker for ovarian cancer. So if it is elevated, that's a good indicator. And then we have a pap smear. Ladies, you should all know what a pap smear is. Men, it is the assessment of the cervical and vaginal secretions to look for potentially cancerous cells. And this is how cervical cancer is typically detected. Let's see, they show you a picture of it in your book, and I'll show you what it looks like on the next slide. So this is what a pap smear looks like, and it's called a pap smear based on the person who first came up with this test back in, I believe, in the 1940s. There's a little blurb about it in your book on page 324. But basically what they do is they insert what's called a speculum, that'll be one of our words later on, into the vaginal opening to spread the vagina open, and then the doctor sticks a very long Q-tip in through the vagina and basically swabs the tip of the uterus and vaginal area to pick up some cells. That is then smeared onto a slide, and then that slide can be looked at under the microscope for potentially cancerous cells. Hopefully the easiest review question ever. A mammogram is a radiographic image of the uterus, uterine tubes, vagina, or breast. Hopefully you choose breast. We're now to the complementary terms. The first pair we have gynecologist and gynecology. So this is the person who studies in the field of study of women and diseases and disorders that are associated with women. And gynecology is abbreviated GYN. We also have gynopathic. And ic as a suffix means pertaining to. So in this case, it is pertaining to a disease of women, like breast cancer. Well, no, breast cancer can be in men too. Like cervical cancer or ovarian cancer. Leukorrhea is white discharge. In this case, we're talking about white discharge from the vagina area, as could be seen in a yeast infection, for example. Mastalgia. Algia is a suffix that means pain. So this would be breast pain for some reason. It could be breast cancer. It also could be an episode of mastitis or something else. Mastoptosis is a sagging breast. So gravity does its magic as women get older and the boobs begin to sag. Then you can get a mastoplasty to, fix that situation. The next term, menarche, I had never even heard of this before I started teaching this class, but menarche is the beginning of menstruation. So it marks the period where a woman gets her first menstrual cycle. This is usually somewhere between 11 and 16 years of age. Then we have vaginal and vulvovaginal, which means pertaining to the vagina or the vulva and vagina. Alright, here's the last list of words for this chapter besides abbreviations. Contraception, I'm pretty sure you all know what that is. Any form that will prevent conception. And this is also referred to as birth control, or BC. Dyspareunia is difficult or painful intercourse. So this could be for a number of different reasons. One common reason is for women after menopause, for example. A fistula, I mentioned previously, is anywhere there is an opening between two areas that should not have an opening. So we talked about one between the bladder and the vagina, but it could be in different areas of the body as well. Hormone replacement therapy, or HRT, is where you start taking artificial hormones to replace ones that your body is no longer producing, such as estrogen or progesterone during menopause, which is the next word. Menopause is kind of from word parts, meno meaning menstruation, but it is where the female stops having menstruation. This is usually somewhere between 48 and 53, but it could be earlier or later. And usually if someone has their ovaries removed, then it could start earlier. And it's associated with lower hormones, which is why hormone replacement therapy is often recommended as well. Premenstrual syndrome, or PMS. And guys, I'm sure you all think this is a real thing, but it is physical and emotional symptoms that occur about a week to 10 days before actual menstruation takes place. So the female is typically tense, irritable, they might have pain in the breasts, headaches, and a few other symptoms. And lastly, a speculum. A speculum is a instrument that opens a certain cavity to allow for inspection. So we talked about a vaginal speculum previously that's inserted into the vagina to open it up to get the pap smear. for example. You can see a picture on page 329. Here's the list of abbreviations for this chapter. It's a pretty long list, so please make sure that you do the exercise 39 and get these ones straight, because there is a lot of them. Which is the abbreviation for inflammation of the female pelvic organs? Is it PMS, TSS, TBS, or PID? Well, the correct answer is PID, meaning pelvic inflammatory disease. A, we just talked about, means premenstrual syndrome. TSS was toxic shock syndrome, and TVS was transvaginal sonography. Please take some time to read through this slide and the next slide just to put these terms to use. Make sure that you understand what's happening in the scenario, as well as being able to identify the meaning of the bold-faced words and pronouncing them correctly. For example, menometrorrhagia is not the easiest.